Hi, I'm Catherine Lourey, Mental Health Commissioner from New South Wales.
And Catherine, what have you come here? What would you like to see on the table at this summit?
What I really want to see on the table today is about how we deal with people in distress. EDs are not the best place for people in distress. They are the best place when you need good care, acute care. People with mental illness have distress. They don't all need to be there. But we've got to remember, we have a 20-year life gap between the rest of the community and those with severe mental illness. We need good physical health care and good mental health care, and EDs can be a real key player in that.
So what can you give as an example of a way ahead?
A way ahead, I think collaboration in the community to really help people when they become distressed, to hold them in the community with their networks with their GPs and with their community health providers, so that when they do need acute care, when there is an emergency, that they then have a straight, clear line into the ED. It's about separating that out so we get the best care and that staff get to work to the top of their skills.
And tell me, is the NDIS going to enable that?
The NDIS can help, but we really have to rethink about how we support people when they're having a crisis in their life. And an ED and ringing 000 isn't always the answer.
Thank you very much. Okay, Neale.
Yes. So, Dr. Neale Fong, I'm the chair of the WA Country Health Service. So
what do you bring to the table here today? Regional and remote issues. What are they?
Particularly interested in how we deal with patients in crisis or people in crisis in mental health in regional remote areas. At the moment, even in some of our bigger hospitals, we're still having to anaesthetise people and get them on air transport back to capital cities, and that's just not good enough. So,
can you map a pathway like that for us?
If we don't have the facilities or the personnel in some of our country towns throughout Australia, then the only way that we can transport people safely for themselves and for the people transporting them is by basically putting them to sleep and then having to wake them up again in an ICU in a city hospital. That's just unacceptable. Well, can you imagine? You've got you're a mental health patient with a mental health crisis, and then suddenly you end up in an ICU with a tube down your throat. It's not exactly the best way to operate. So we've got to get into the 20th century in that space, and that means by putting resources where they should be and identifying people and looking after people one-on-one almost throughout regional and remote regions.
Give us an example. What would that look like in a typical country town?
Well, it's a major crisis. We're talking about aeromedical transport. We're talking about ambulance transport. We're talking about people that aren't necessarily skilled to kind of look after.
But to fix it, what would you need?
Well, we actually need to think outside the box a bit here, and that's why hopefully there's going to be some innovative and some digital health solutions that can be brought to the table to help remote and rural people.
Fantastic. Good to have you here. Thanks so much. And finally, Maureen.
Hi. Maureen Lewis, National Mental Health Commission. I'm the interim CEO.
Well, congratulations and welcome.
Thank you.
What were you bringing to the table today? What's the big picture for you?
So I think for the Commission, with our role in monitoring and reporting at a national level, it's really important that we know of all the issues that are going on in mental health across the board. We visit rural and remote communities with our commissioners several times a year, and we hear all the time about these issues in emergency departments for our patients with mental health problems. For us, what I'd like to see out of today is this is a shared sort of goal we should all have together. Often it's put down on mental health or not turning up to do what they should for mental health patients. It's for all of us. We all need to work together. We need to collaborate, and this is a shared vision and goal for all of us, so we improve outcomes for people with mental health.
And the National Mental Health Commission of all organisations knows how many times solutions have been put on the table, and it doesn't happen. What is needed to actually make change happen?
So I think what's needed today is that some agreement from all of us. So often we talk and we've all got goodwill. We need something signed, something we can take to governments across the board and actually say this has to happen, this must change. And it's one of those things where if we did things differently, we would actually save money in the long run and improve outcomes for people with mental health.
Fantastic. Thank you very much for talking before the summit starts.